We're going live now.
Good morning, everyone, and welcome to this meeting of the Audit and Performance Committee of the Perth and Kinross Integration Joint Board. I'd like to apologise for the delay in starting. That was due to some technical difficulties on my part, but we shall now begin. I would like to ask the clerk if there are any apologies for this meeting and any substitutions.
Thank you, Chair. We have apologies today from Bernie Campbell, and I was about to say apologies from Pat Kilpatrick. I think possibly Pat has just joined us.
Yep, I'm on the conference call. Yeah.
Thanks, Pat. So we also have apologies from Diane Fraser, Hamish Dougal, and Evelyn Devine.
Okay, thank you very much. If we move on now to item 3 and item 3.1, which is the minute of the meeting of the Audit and Performance Committee that was held on the 17th of February. Are people happy that this minute is an accurate record of that meeting that was held then?
Agreed.
Okay, thank you. And if I now pass over to the Chief Financial Officer, who will give a verbal update on the action points arising from that meeting. Chief Financial Officer.
Thank you, Chair. In terms of the action points being carried forward from previous meetings, we've actually got no actions still outstanding, and we've formally not picked up any actions that have gone into a formal action point update for this meeting either. However, on reading the minutes, there was one issue in particular that I wanted to raise this morning, and that was in relation to the appointment of a risk champion for the IJB. That was due to be discussed with the chair of both the IJB and the Audit and Performance Committee to progress. We subsequently had some further discussions with the Chief Internal Auditor, and would like to, and now are in a position to discuss further with the Chair and the Chair of the Audit and Performance Committee how and who we now appoint to take that action forward. And that's been has been affected by the activities of the last 12 weeks, but we now will try and progress that prior to the next meeting.
Okay, thank you. Can I ask members if they could indicate if they have any matters arising from that minute or from that the reference to the action point that the Chief Financial Officer just made that is not covered on the agenda today? No? Okay, thank you very much. If we move on now to the first substantive section of the agenda.
Sorry, Chair.
Oh,
sorry, I was on mute. My apologies.
Okay, Mrs. Kilpatrick.
Sorry, I was on mute. Yeah, so you didn't get any background noise. So, if I could just go back to the previous minute, there was a point raised about the clinical governance, professional governance, internal audit report, and it said that a senior manager had been commissioned to review and prepare a report. I just wondered if we've got an update on that.
Okay, thank you for that. Is anyone able to answer that question?
Chair, if I could.
Okay, Chief Officer, thank you.
Thank you, and thanks for the question, Pat.
Yep.
We commissioned Maggie Rapley, one of our colleagues who has since retired, to carry out a piece of work to look at how we could best ensure that we were complying with the requirements of that audit report, but equally the integration scheme. And in doing so, we looked at the arrangements within NHS Tayside, particularly around getting it right for everyone, as well as the audit requirements, and considered in that context. We also did some benchmarking information, which we were encouraged to do, I think, by David Williams, when he provided some input to the IJB. In that context, we were also reviewing the relationship that might come to play between the Audit and Performance Committee, the IJB, and the proposed Clinical and Care Governance Committee. That review has been undertaken and concluded. Unfortunately, we have not been able to make any progress in that regard. And as a consequence, what we've agreed is that we would bring forward an update report in relation to the activities around clinical and care governance to the IJB meeting that takes place in early July. So Hamish Dougal as our clinical director and Jackie Pepper as the chief social work officer convene a regular clinical governance forum where they receive and approve assurance reports across the range of services that are delivered within the Health and Social Care Partnership. So I've asked Jackie and Hamish to provide a report to the IJB in relation to the assurance that they can provide, which may also enable us to have a further discussion about the arrangements for clinical and care governance, and indeed whether that approach is perhaps preferable to instituting a further committee, but that would obviously be a matter for further discussion.
Thank you, Chief Officer. Mrs. Kilpatrick, are you happy with that response, or did you want to follow up?
Well, I'm not sure if it's a note or a question really, but other IJBs do have care governance committees, I think, Gordon, don't they? And would we be out of step then if we don't have a care governance committee? Is that an odd arrangement that we don't have one currently, or is that
Chief Officer?
a decision that was taken?
No, I haven't got a full sort of comprehensive view of the landscape across Scotland, but I know probably as many don't have as do, and that's because some partnerships have taken the view that the delivery of clinical healthcare services continue to have to be reported to the NHS Clinical Governance Committee, and some councils continue to have professional social work committees. So there's a very mixed bag across the country, and it's really for us to consider perhaps in the context of the integration scheme, but we also have the opportunity, or the IJB has the opportunity, to influence how the integration scheme might be developed to either capture this or address the matters in a different way, because we know that we have to review the integration schemes formally in the next 6 months.
Okay, thank you for that, Gordon.
Thank you, Chief Officer, and thank you, Mrs. Kilpatrick. And just on that, while we don't have operational risk responsibility for the operational risk, we do retain responsibility for operational oversight of the delivery of services in line with the objectives that we set out in the strategic plan. And I think, as Gordon has highlighted, different IJBs take a different approach, whether that's a committee or whether that's reporting to the Integration Joint Board itself as an item. But I think it is really important, having identified that gap in assurance as part of previous reports both to this committee and to the Integration Joint Board, that whatever form it takes, the Integration Joint Board is able to get that assurance. So absolutely, both the Chair and I will take that forward and try to follow up on that in the next few months. Okay, if there are no further matters arising, then we'll move on now to the performance section of today's agenda. Just before we start that, I'd like to acknowledge the work that has been done by officers and indeed all health and social care staff on the ground in tackling the coronavirus pandemic, the COVID-19 pandemic. We've seen excellent work mobilising all of our resources and trying to tackle some of the issues that have been presented with us over the past few months. In relation to the items on the agenda today, that does mean that we have not been able to progress some of the work that we would otherwise have liked to have done. And there will be instances where things are delayed or reports are not as full as we would like them to be. But I think everyone would accept that, given the current situation, that is an understandable situation, and officers and we as board members we'll do our best to try and ensure that those reports and other items that need to be actioned are brought forward as soon as possible in the coming weeks and months as we move towards a different stage in this pandemic. So with that in mind, as we go forward through the agenda, I'd like to ask the Chief Officer to speak to item 4.1, which is the Health and Social Care Partnership COVID-19 pandemic response. Chief Officer.
Thank you, Chair. Firstly, can I apologise for the late submission of this report? Unfortunately, I was unable to prioritise it ahead of other demands over the preceding few days, and it was therefore then only issued late yesterday. So I shall perhaps spend a little bit more time than I might otherwise going through it for the benefit of people who might not have had the opportunity to fully consider it, albeit it is a short summary report, which I think is significantly reflecting the Chair's comments a moment ago, that our focus has been around inevitably the demands of COVID-19 in terms of the work of the executive team and colleagues across the Health and Social Care Partnership, which is acknowledged, I think, in the first paragraph, and I would wish to emphasise the comments I make in the second paragraph to endorse those that the Chair has kindly conveyed and which will be communicated more widely, a recognition to staff of the work that they've done from this committee, and I'm grateful for that. During the most challenging time, colleagues have been stepped up and really come to the fore and shown significant versatility and professionalism and commitment, and worked across integration in a way that we need to think about how we can capitalise on, work digitally, used technology, supported local communities. So much to be proud of and much that we need to think about as we move into the next phase of responding to the pandemic. And as I have said, I think perhaps to the IJB and elsewhere, when we first moved into this position where we were responding to COVID-19, we may have anticipated that we had come into the pandemic and we would come out within a few months. But clearly, the situation that we're all facing now in how we work and how we live, how we engage with others is significantly affected and will continue to be by COVID-19 for some weeks and months to come. So now we're talking about this being a marathon rather than a sprint. Now we're talking about how we live and work with COVID, and the substance of my report effectively reflects some of the challenges that we're facing. Members of the Audit and Performance Committee will be aware that on the 29th of May at the IJB, I provided the IJB with a full report at that point in relation to the activity that was underway in response to COVID-19. This report provides a brief summary update and reflects some of the challenges, because we have moved into that next phase, or we're transitioning into that next phase, and that's placing significant demands on us. Perhaps a different type of challenge, because when we were responding to COVID-19, we were in battle mode, we were geared up, it was the only show in town, that's what we needed to do. We were focusing our activity on it. It was an emergency response in the context of that civil contingency. But now we're in a different phase. We're in a phase where, as my report indicates at section 2, we're continuing to manage the impact of COVID. We cannot be complacent about this. We cannot underestimate the fact that COVID-19 is still affecting people, individuals, their families, carers, communities and services, particularly perhaps to a greater degree than in the acute services provided by the NHS. It's affecting community services, community health and social care services. Significant focus at the moment on care homes for older people. We continue to work very closely with colleagues, and I'm pleased to see that Lynn Blair has joined Audit and Performance Committee today. We've worked very well with Scottish Care, and I would wish to commend Lynn for the partnership approach that she's facilitated to enable us to do what we can to support care homes for older people across Perth and Kinross in terms of staffing, clinical oversight, PPE, guidance, and significantly testing. Tayside's been at the forefront of testing social care staff. So we're continuing to deal with COVID. However, we need to transition, but in transitioning, we need to retain capacity to respond to a second surge. So we need to be prepared. We need to have that insurance policy, that capacity ready to be geared up should we experience a further spike in the pandemic. And over the weekend, we've seen what's happening in Germany and what's happening in China again. So we cannot afford to be complacent, and we need to build in that capacity. So those are two key activities we're undertaking in tandem. The other thing we have to do is, by necessity, we need to think about how we deliver against some of the social intervention measures that are being required by government. And rightly so, the limitations on physical contact, on travel, on shielding, and we need to be sensitive to the potential impact that protect and test might have. We know that if staff are identified as having been in contact with people who are positive, and particularly out with their work, that may require them to self-isolate. So we're thinking about that, and we're working around that. The other thing that, I mean, for some members, it may surprise you to know that we're planning for the winter. At this time every year, and anticipating significant demand on NHS services over the winter months, we begin to bring together our plans in terms of how our community services will be geared up in a way that ensures that we can take some of the pressure off the NHS and ensure that people can get the treatment that they need when they need it. So we're doing that at the moment, but we're doing that with a number of unknowns. We need to anticipate and plan, but with the uncertainty about how the pandemic will progress, and that's presenting some challenges that we need to work through over the coming weeks. And finally, in terms of the activity that's underway within the Health and Social Care Partnership and across our executive management team and with our colleagues in the integrated management team, we're reviewing the programme of work and activities and ambition that we had set out at the beginning of this year. So we're having to look at our strategic commissioning plan, our improvement plan, our transformation plan. And while I haven't mentioned it explicitly within the report, we're having to look at our financial plan, the budget. What implications does COVID-19 have for all those plans, for our ambition? Looking through that COVID-19 lens, then, are these plans still valid? Are they relevant? Are they achievable? And are they perhaps affordable? Are they now our priorities? So there's a significant amount of work underway within the partnership, and we are reviewing those plans and hope to be in a better place, certainly by the time we report to the next IGB, on which aspects of our activity has to be stood down, and how do we give effect to our priorities, and how are we delivering new models of service delivery in the context of the operating environment that we find ourselves in. Important probably to say that none of that will perhaps deflect away from our high-level strategic priorities about early intervention and prevention, around the best use of our resources, around working with communities, and around addressing health and social inequalities. These priorities perhaps become more acute and more relevant in the context in which we're working. So I would commend to the Audit and Performance Committee the work of staff over the preceding 3 months, and highlighted in this report some of the activity that is currently underway in order that we can begin to adjust, transition into this new way of working, and to review and reappraise what our priorities are going to be for the coming year. And there's a significant amount of activity. I wouldn't wish to underestimate how much work's going on behind the scenes in terms of our mobilisation plan, the budget that is needed to support it, the reprioritisation of services, and the implications of delivering things differently. My report comes with a short appendix in which I've sought to provide the Audit and Performance Committee with some information, data in relation to the activity in Perth and Kinross, the impact and implications of COVID-19, and how the system has flexed in order to respond to this. I do accept that these are not necessarily providing measures of our performance. Some of them are about activity, but I think there are links there to the work that we are doing. So we've taken information from National Records of Scotland in relation to the impact of COVID, and included within that is published information around how many people in each of these areas has sadly succumbed to the virus, the number of people who've died since the first case was identified in Scotland. And then there's some more detailed information that reflects where COVID-19 was mentioned in people's death certificates, where they were at that point. So this really just tries to reflect the fact that we have been in a position where we managed to respond, I think, very effectively in relation to the prevalence of COVID-19 in care homes. And whilst a number of people have died, the numbers are perhaps thankfully less than other areas are experiencing, and we have to be grateful for that. Important to say that it's not an error. There is a same figure is repeated twice. We've got the numbers of people who've died in care homes at 20 in terms of the National Records of Scotland, but at 23 in terms of the later report. The later report reflects our real-time monitoring on a daily basis within Perth and Kinross, and that figure is perhaps more accurate than the figure within the NRS records, which are up until the 1st of June. So that means that 3 more people have died since captured in the National Records of Scotland records in care homes in Perth and Kinross. One of those relates to someone who had sadly passed away some weeks earlier, and the records needed to be updated. In relation to the others, a couple of people who have been living with COVID or managing for some considerable time deteriorating health at a point when they have had a COVID diagnosis. So that explains the variance in figures. I've also included a report that we take to a weekly sounding board of Perth and Kinross Council around care homes, and members will be interested to note that across Perth and Kinross we've had outbreaks in a number of our care homes. 7 care homes have had positive residents, and at various times 21 of the 40 care homes in Perth and Kinross have been closed to new admissions. Only 4 remain closed at the moment, one of which has an outbreak of COVID, and that reduces obviously some of the capacity that's available to us. This report also highlights that we have NHS Tayside have tested 344 staff in Perth and Kinross care homes. These are situations where there have been outbreaks or cases of suspected COVID, and the NHS testing team have quickly responded by coming to care homes, testing staff, in most cases providing assurance that they weren't positive and could continue to work, and in some situations identifying that people were indeed COVID positive. So 344 staff tested by NHS Tayside in response. So this is the more reactive testing in response to an outbreak or suspected case. More recently, there's been significant work being done by the UK and Scottish governments to promote and increase the take-up of the testing of asymptomatic staff, so volume testing across care homes where there are outbreaks. And in the first week of that promotion or that increased focus, we know that the report that we had last week indicated that 738 staff in 19 care homes were to be tested in the coming week. Their employers having signed up to the UK Government Social Care Portal, and the arrangements being put in place for those staff to be tested. Arrangements that are enhanced by the delivery of the test kits by courier, the collection by courier, and the processing of tests now being done in Scotland and able to therefore be turned round in 72 hours. So there's a significant focus now being given to the testing more generally across care homes. And in the first week, as I say, that number increased. We will be getting a further report today in relation to further tests that are being planned through that route. And we are keeping a close eye on the implications of that, because significant numbers of positive tests would certainly have significant challenge for the care home providers in terms of staffing their service and sustaining their service. So we would look to see what support we could provide in those circumstances. Hopefully that covers most of the report. I'm grateful to colleagues for listening to what was a perhaps more detailed account reflecting the fact that the report was only issued yesterday, but I'm happy to take any further questions in relation to the general report information that I've conveyed, or some of the more detailed information that's perhaps included in the appendix. So I shall stop there and hand back to Chair. Thank you very much.
Thank you, Chief Officer, and thank you for going into that in more detail than you would usually have done at the meeting. If I can just remind members if they can indicate if they want to speak in the manner that Councillor Duff has done. I'll also come to Mrs Kilpatrick once we've had questions from others, noting that she's on the phone and not able to notify me in the way that others do. Councillor Duff, if you want to ask your question, please.
Thank you, Chair. Thanks. Gordon, yes, I was just interested in what actually constitutes a COVID-19 death. Is it the death of anyone who has tested positive for the virus, or does it have to have some further, bearing on the actual manner of the death?
Chief Officer.
That's a really good and important question. So the recorded deaths reflect people who have tested positive from COVID and who have died with COVID. The question you're asking, I think, is really valid. That does not mean they have died from COVID. It just means that they have had COVID at the point of their death. And we need to recognise perhaps that population in our care homes are sometimes being supported with palliative and end-of-life care. So it isn't the case that we can attribute COVID to each of those deaths, just that people who sadly passed away during that period with a diagnosis of COVID have been recorded amongst that figure. So hopefully that answers that question. I see you've got a further question about a second surge, Councillor Duff.
Yes, thanks, Chief Officer. Yes, no, I think it helps to kind of explain the variation, I think, across countries about figures, just to understand a bit better what we're actually recording as a COVID-19 death. The other question, yeah, in the section 2 of your report, you talk about the potential for a second surge, and I just wondered if you had any general information about, when that's anticipated and what it's likely to look like.
I don't really know. I think this is just one of these contingencies that we need to be aware of and plan for in anticipation that there may well be a further spike. I think obviously governments are taking giving very careful consideration around what they describe as the R number in terms of the easement of lockdown, and different countries at different stages are taking different approaches. So we really have no insight into whether or not we can reasonably predict a second surge at all, or within 4 weeks or 10 weeks or whatever. The situation is that we're trying, obviously, collectively and nationally to contain the spread and levels of infectivity and contact. So this is really just us having that contingency in anticipation that it may arise. We very much are again in the position of planning for the worst and hoping for the best. But because it has attracted media attention over the weekend, I didn't mention the fact that we're now having to reflect on developments that are taking place in Germany and back in China, from where this first originated. And I know that there are also particular industries where high levels of prevalence are now being reported. Part of the challenge, I suppose, that this is all very new. It's a new pandemic, it's a new disease. So some of the science is fairly early in its development, and some of the learning that we're having to take from other countries we need to adapt rather than adopt, because the operating conditions and the social interventions and the restrictions in each country is perhaps different. I think we would wish to be in a position where we were much clearer before we go into the winter months about what the implications of all this will be, not only because of the demands on the system, the hospital and acute services and community health and social care services, but obviously because we need to recognise that we plan already for a flu pandemic, and what we would wish to try to do is mitigate the impact of that sort of double whammy of COVID plus flu. And I'm not cited in any science that might tell me whether that is likely or and how significant it might be.
Okay, thank you.
Thank you, Chief Officer, and thank you, Councillor Duff, for that question. I'll give others an opportunity to come in with any questions, but while I'm waiting for that, I'll ask a question, Chief Officer, if I may. One of my main concerns has been that while it's very difficult, as you've already alluded to, for us to predict how the virus will develop and model in terms of how we have to tackle it with our response in the NHS, one of my main concerns is that the actions that we take might have a worse impact themselves. So obviously we've had things like acute services, elective activity, outpatients, clinics that have been delayed because of the need to build up capacity to tackle coronavirus. But as we've seen across the UK with the Nightingale hospitals that have been barely used, and I can't remember, I think when we last spoke it was something about we hadn't even reached 40% ICU capacity in Tayside. Now we might well have exceeded that in the interim, and perhaps you could touch on that. I'm just conscious of, if we do have a second surge, while it's great to see that we are resuming services, elective activity, outpatients, clinics, that we will try and ensure that we get the balance right so that the impacts on those who aren't affected by coronavirus but do have a health need don't end up getting negatively affected because of our understandable attempt to tackle coronavirus, when actually we might be doing more harm than good.
So I think the key word there is that, as you've rightly highlighted, Chair, balance. What we are looking at doing is how we remobilise services, but we're looking at that through the whole system. So myself and the other two Health and Social Care Partnership Chief Officers have a weekly call with the Chief Officer of the Acute Division within NHS Tayside. We also have Chief Officers meetings once a week with Scottish Government, and I continue to remain a member on behalf of the Chief Officers of NHS Gold Command in terms of their COVID-19 response. Across each of these fora, we are very clearly discussing the whole system approach that needs to be taken and the need for that balance. So what we don't want is necessarily the reinstatement of significant hospital-based acute operating division services, electives, outpatients, clinics, at the same time as we have insufficient capacity within the community services. We need to look at capacity and flow through that whole system, and we need to make sure that if we're easing off on one part of the system, that the pressure that brings to bear elsewhere in the system is fully recognised. So we're working in a very cooperative way across the whole system, and we're looking at the potential unintended consequences if for example, the hospital service, acute hospital services, were gearing up. This has been recognised in guidance that's been issued by the Scottish Government in terms of the remobilisation of the NHS. But obviously that balance needs to take account of the fact that there are people with non-COVID related health issues that need to now begin to be considered, and the reinstatement of electives and some treatments will go some way to address that. So it is being looked at in the round. A whole system approach has been taken, and the balancing of the impact on acute hospital and the community, and the balancing of risks is informing any consideration that is being brought forward.
Thank you, Chief Officer. I'll ask now Mrs. Kilpatrick if she wants to add anything, noting that you're on the phone.
Thank you, Chair. Gordon, in your report on the RAG rating, at the page, page 11 out of the 12 pages, there's 5 criteria which they're scored on. Criteria number 3, the knowledge and adequacy of infection control. You've got one care home which still has deep concerns with their ability to cope or sustain best practice, and also on section criteria 5, overall performance. I don't know if that's the same care home, but I mean, assuming a care home might have 30 residents, although it's only one care home, it might affect 30 people plus the staff. It may have more residents than that. I don't know what the average size is in Perth and Kinross, but could you tell me, if is that the same care home, and if it is, and even if it's not, what steps are we taking to address that? What support and additional resources or whatever? How are we dealing with it? How are we managing it to get it from red through to green? Thank you, Chair.
Thank you. Yes, so that's a really helpful question, because there's a lot of work going on in and around this that the committee may wish to hear a bit more about. So firstly, we have daily safety huddles within the Health and Social Care Partnership, where we are considering all the care homes, but particularly those that have a red or amber status across those criteria. We have daily contact with those care homes that are red or amber in relation to the issues of concern that they are managing. I have to say that we're taking very much a supportive and improvement focused approach with care homes. We're not in the business of looking at sort of compliance and enforcement activity. We recognise that for some care homes may well be the interface that they might have at times with the care inspectorate, but what we're seeking to do is to work with care homes. So we have these daily meetings, we have reports that come in, and we have a weekly report that collates all the information and which will now be supplemented by information on the arrangements for testing asymptomatic staff. What we also have initiated are a programme of visits, and we're visiting 5 or 6 care homes each week. This is visits carried out by colleagues with a clinical background, an understanding of infection prevention and control, adult protection, a range of areas that are perhaps reflected in the criteria on that RAG rating. 5 or 6 visits a week. I think we've probably done about 18 or 20 visits, intending that we finish these by the week ending the 5th of July or whatever week that is. And these are visits that we were encouraged to carry out by guidance that came out of Scottish Government to Directors of Public Health. Very pleased to report that care homes are receiving those visits well. They are welcoming our involvement and our attendance and the guidance and support that we can offer them. The other aspect that we've introduced is a daily meeting of a clinical oversight group that is chaired by the nurse director, that involves the medical director, the 3 chief officers and the 3 chief social work officers in each of the council areas. It is meeting each day at 1 o'clock, and it is the forum to which any issues that were emerging locally would be escalated in order that we can look at how we can combine and marshal our available resources to provide support should that be necessary. It's been meeting now for about 3 weeks, and is another part of the range of measures that are being provided. So the RAG rating that you've got, because of that level of activity, is quite dynamic. It may well have changed in the next 2 or 3 days. The one care home that is in the red category is the care home that has an outbreak at the moment, and with whom we are working very closely. We've done surveillance testing across all the staff. we've got one resident who I think is currently being supported to isolate. And that number was at 2 last week, but we had a positive visit to one of the care homes from our staff and then from the care inspectorate, who identified that the situation had improved, and that second care home was one of the ones that is considering accepting new admissions again. So it's a very focused, support-based activity. The situation, as I say, is quite dynamic, but we are very much benefiting from the good work that Lynn Blair from Scottish Care has initiated with the sector, which extends to weekly Zoom calls with providers, and hopefully they would report that they're benefiting greatly from that. So quite a comprehensive support package being wrapped around care homes at the moment, and rightly so, because of the vulnerability of the resident population there.
Thank you, Chief Officer. Mrs. Kilpatrick, are you happy with that, or did you want to follow up on anything?
No, I think that's very comprehensive, and obviously there's a lot of work going on to support care homes, so thank you for that, Gordon. I appreciate it. Thank you.
Okay, thank you. Just finally, are there any further questions that members wanted to ask on the COVID-19 response update?
Callum, I would like to ask a question.
Okay, yes, Mr. Erskine, that's fine, thank you.
Thanks, Chair. Can I just clarify, if you're looking for someone notifying you of wanting to ask a question, do you put the video on, or do you want something in chat?
Yes, if you just indicate in the chat that you want to, just say you want to ask a question, and then I'll bring you in, but that's fine.
Okay, I'll know that. Thank you. Next time. It's really a point rather than a question. The paper itself, I think, is valuable, a really helpful update for the Integration Joint Board. The question I have is, the point really is in relation to governance. I'm not quite sure if this paper is really one for the Integration Joint Board rather than the Audit and Performance Committee. And in my first meeting here, having looked at the remit and the terms of reference for audit and performance, I know we have an overview for the arrangements that are put in place in relation to performance. I would just be slightly anxious about getting into the detail and treading on the toes, if you like, of the Integration Joint Board itself in relation to some of the more operational matters. So I don't know if Gordon or the Chair may want to comment on that, but I'm just trying to understand where that dividing line is between APC and the board itself. Thanks.
I'll thank you for that question, Mr. Erskine. I'll maybe start, and then perhaps the Chief Officer might want to add some comments. I asked the Chief Officer if he would bring forward a report on the COVID-19 response, primarily because, as we are an Audit and Performance Committee, we have to have an understanding that our responsibilities in relation to the operational oversight of the Health and Social Care Partnership. I think you're right in that the review that is going to be undertaken, and indeed the review of the integration scheme, will perhaps inform how we operate going forward. I think it is unusual to have a committee which is both an audit and a performance committee. From a council perspective, it's almost like having both the audit committee functions of finance and governance combined with the scrutiny functions in terms of service delivery, and ensuring that the strategic objectives are met in the operational delivery of services, and that you would usually see in a scrutiny committee combined. We have had discussions before about whether it might make sense to separate those out, but at this moment in time, that's not where we are. We've obviously had discussions earlier on, again, about operational delivery in relation to clinical care and professional governance. So I think at the minute, given that we are also a performance committee, it is incumbent on us to ensure that we are kept abreast of those operational delivery updates without necessarily going into the specific details, but ensuring that we have assurance on that. But it may well be that those arrangements might need to change as part of the review of governance arrangements going forward. But I don't know if the Chief Officer wants to add anything to that.
No, so that was a very comprehensive response, which captured aspects of what I would have perhaps indicated. I think the other thing to highlight is that we would be tending to focus at this committee on matters to do with risk, audit, performance improvement. It has been recognised, though, by the committee that there has been greater focus given to the audit activity, and we have therefore then been looking at how we could bring forward different types of performance reports. This, however, is a committee that has been, or the agenda for this committee and the substance and the detail within the reports has, as the chair indicated from the outset, and as I've reiterated, been affected significantly by COVID-19. So it's maybe a slightly different focus today than might align to the terms of reference, and there is a recognition that we need to develop our approach to better address the requirements of members of this committee.
Thank you, Chief Officer. Mr. Erskine, did you want to make any further comments, or are you happy with?
Yes, just briefly, Chair, that's very helpful, and I'm aware of the chair of the IJB initiating a governance review, and I'm quite sure that everyone will be able to feed in the relevant comments. Audit and performance going together, as you say, is perhaps not normal, but we have a small group, so I guess it's worth reviewing. But thank you for that update.
Okay, thank you. If there are no further questions, then we shall move on to item 4.2, which is a report with an update on the publication of the annual performance report, and I'll ask the Chief Financial Officer to speak to this report. Thank you.
Thank you, Chair. This was due to be a verbal update to the committee, and that was what was agreed with the Chair. So apologies, Chair. It subsequently became apparent that we did require to bring forward formally our intention to delay publication of our annual performance report. The regulations set out in the Coronavirus Act 2020 allow us to do so, and the intensive activities over the last few months have meant that we are in a position where we need to delay the work required to bring that report forward. So we are bringing the formal request to the Audit and Performance Committee today to delay the publication of the IJB's annual performance report, and would seek to bring it to committee in September.
Thank you for that, Chief Financial Officer. Can I ask members whether they are happy to agree to this request, or whether there are any questions? Okay, Mr. Erskine.
Thank you. Thanks, Chair. And Jane, it's just a very short question. Can the committee be assured that the September timeline can be met? Thanks.
Chief Financial Officer.
Yes, we are currently aligning resources to ensure that the deadline can be met. What I would say, however, is that the report that comes forward, whilst it will meet the legal requirement, it may look and feel slightly different to previous reports due to the fact that the resources that we will bring to bear to bring it forward have been affected by, or are affected by, the parallel need to work on our response and renewal plans in relation to COVID-19, but it will fully meet the legal requirements.
Thank you, Chief Financial Officer. I am happy to move the recommendation that we approve the postponement of the publication of the annual performance report until September 2020. Can members indicate if they are not happy to proceed on that basis? Otherwise, we will take that as agreement. Okay, that's agreed. If we move on then to item 4.3, which is the 2019-20 financial position report, which has already been to the Integration Joint Board, but I'll ask the Chief Financial Officer whether she has any further comments to make the Audit and Performance Committee on this report.
Thank you, Chair. As you've said, this paper was presented to the IJB, I'll just give a brief outline of the outturn for the financial year, which was an overspend of £1.798 million. That is a significant improvement on the £4.2 million gap set out at the start of the financial year. Two key factors impacting on that improvement. Firstly, a significantly improved position on GP prescribing, driven by national issues, profit margin and price rebates, which were not anticipated at the start of the financial year and have given a £1.2 million benefit. The social care position is £1 million better than predicted at the start of the year, in part due to the recovery plan actions that have been undertaken by the partnership, and in part due to an unanticipated level of underspend on care at home. Perth and Kinross Council and the NHS Tayside have, however, advanced additional budget that formally allows the IJB to present a break-even position in its financial statements. Reserves are being carried forward. The balance being carried forward is significantly reduced from last year, and we carry forward £1.159 million of earmarked reserves. These are fully committed to spending plans that will take forward in 2021, although along with all other resources, these will be under examination to ensure that they are best supporting service needs through a COVID-19 lens. I'm happy to take any further questions in relation to the outturn position.
Thank you for that, Chief Financial Officer. Could I ask if members could indicate if they want to ask any questions on the report, please? Councillor Duff.
Sorry, there we are, unmuted. Yeah, no, it's just in paragraph 2.2, I was just looking to understand a bit better what the unanticipated benefit of 364,000, significantly driven by changes in Tayside psychology services. And I presume in the final paragraph at 5.1, it also refers to the £364,000 benefit being forecast on an annual basis. Is that the same figure?
Chief Financial Officer.
Yes, thank you for the question. You're right to point out, Councillor Duff, that we have had an unanticipated benefit from other hosted services, and that dominantly relates to an underspend in psychology services, which is hosted by Dundee. That wasn't predicted at the start of the financial year. However, when we look back at previous financial years, there has been a consistent level of underspend, primarily driven by huge vacancies in the psychology service, which, from a financial perspective, is giving us a benefit, but from a service perspective, and I would ask the Chief Officer if he wanted to make any comment on that. Does give cause for concern that year on year we are seeing the level of vacancies in psychology services consistently delivering a huge underspend. In relation to 2021, you're absolutely right. We are now seeing that level of underspend as effectively as being almost recurring now, and we've built it into our forecast position for 2021 in terms of trying to move towards a break-even position.
Okay, thank you. I wonder if Gordon had a view on that.
Okay, I think the Chief Officer has indicated he doesn't have anything.
And nothing to add. Okay,
thank you. Thank you. Thank you, Councillor Duff. Are there any further questions on this report? Okay, can I just suggest then that the committee note the recommendations in the report at item point 1 of the report. Okay, thank you very much for that, Chief Financial Officer. That concludes the performance section of the agenda. We'll now move on to section 5, which is the governance and assurance section. The first item on this part of the agenda is item 5.1, which is the Internal Audit Annual Report and Assurance Statement for 2019-20. And I'll ask the Chief Internal Auditor, Jackie Clark, to speak to this report.
Thank you, Chair. The report from page 23 onwards sets out the Chief Internal Auditor's opinion and the annual report. Of particular note for this committee will be the opinion which is recorded at section 5 of this report. The Internal Audit Service continues to be provided jointly by Perth and Kinross Council and the internal auditors for NHS Tayside, with the role of the Chief Audit Executive being transferred for the year in question from the NHS to Perth and Kinross. So this report is coming from Perth and Kinross for me for the first time. So it will look slightly different from what you've seen before because of that. Both partner bodies, internal audit services, have been verified externally and are compliant with the public sector internal auditing standards, which is the professional requirements for internal audit in the public sector. So that really just provides the background for the internal audit services that we're providing. The planned work for 2019-20 was paused at the very start of the pandemic. However, work had been well underway for the assignments within the plan. Whilst they've not been reported to the Audit and Performance Committee, as Chief Internal Auditor, I've had sight of the work and I've had discussions with colleagues from both organisations, and I've been able to place reliance and gain assurance from the work that had been undertaken. And the reports will, I anticipate, come forward to the next meeting in September. In addition to the work that from the current year's internal audit plan, all previous years' reports have been finalised within the year. So that's all concluded and that's been considered by this committee. Furthermore, the committee has also considered a report which was undertaken as part of Perth and Kinross Council's internal audit plan in relation to the implementation of the Carers Act, which was of relevance to the work of the partnership. Section 2 of this report also highlights work undertaken and relevant assurances that have been taken from the responses to external audit, external inspections and self-assessments. And I'm very conscious of the level of work that's been undertaken within the partnership, and that has fed into my overall opinion. Sections 3 and 4 of this report are of note to this committee, and section 5, which is the opinion that reasonable reliance can be placed on the risk management, governance and internal control arrangements, obviously subject to the implementation of agreed actions, I'm pleased to be able to report that that I am able to place reasonable reliance. I'm happy to take any questions on the work that has been undertaken during the year and on this report, but this report really it summarises the work that I've brought to the committee over the year. But I'm happy to take any further questions that anybody may have.
Thank you very much for that. I'll ask members to indicate if they want to speak. Just first to thank the Chief Internal Auditor and her team for all the work that they have done throughout the year and providing that assurance on the audit and governance arrangements that are in place to this committee, which is very much appreciated. Okay, I'll ask Mr. Erskine to put his question to the Chief Internal Auditor.
Thank you. Thanks, Chair. Please excuse me if I'm looking at another screen as I talk here, because I'm going to quote a few words. Thanks for that report. I note, first of all, in 1.2, the purpose of this report is to provide an assurance statement on the adequacy and effectiveness of the framework of governance, risk management and control. So it's not just about the internal audit work that was carried out in 1920. So I guess what I did in reading this report is went back and I looked at the 18-19 report that was submitted last summer. And as you mentioned yourself, there's quite a considerable difference in style. So one question, perhaps the lesser of the questions I have really is, why are there different styles? And I appreciate there are different employers and different approaches, but an IJB, I would hope, would see a fairly consistent style of report that meets what's been set out in 1.2. Perhaps, however, more of the focus of the question I have really relates to some of the issues that were raised in that report last summer, the previous report, where there were some fairly serious concerns raised around reports before my time, so I'm not really able to speak on these with any great authority, but other members may be able to recall these better in relation, for example, to the MSG report. Just comments such in last year's audit report, such as vital that arrangements are put in place to monitor and ensure that remedial action has been taken on these matters. I guess what I haven't seen in the report, the internal audit report at today's committee, is anything that would provide me with sufficient assurance that these issues have been addressed. I understand they were fairly serious issues in previous years. And I have I guess a follow-up question on that, which would relate to lessons learned and whether that's something really for the internal audit team to look at and take forward based on the previous year's report and the reports that go to audit and performance through the year, or whether that's something more appropriate for the Chief Financial Officer to carry out. So I've got a range of points and questions, but I mean, I guess what I would be looking for in this report, and obviously paragraph 5 is key, you know, the assurance is absolutely key, is a greater read across and resolution of the 18-19 issues, as well as what's been addressed in 19-20. So I'd be keen to hear comments from the Chief Internal Auditor on that. Thank you.
Well, thank you for the questions. I'll try and answer them, and if I miss anything, please do remind me after I've sort of tried to explain my rationales. Each Chief Internal Auditor will have their own stylistics and the way in which they meet the requirements to report back. So stylistically, it is my style, and I've pulled together within the report a summary of what has been reported within the year. But it is a high-level summary. The reports are publicly available and have been considered by this committee prior to today's meeting. I can certainly provide links if that would be of a help to those reports, but they are sort of publicly available. So there's an awful lot around stylistics and what is required within the SIAS for providing an opinion. With regard to the issues that were raised in last year's report, there have been a significant number of organisational changes within the partnership, which has dealt with a lot of the significant concerns which arose during 18-19, and I think part of the arrangements which I've taken assurances from are regarding governance and regarding the arrangements that have been put in place by the Chief Officer, by the Chief Finance Officer, and their teams to address those matters. I'm not saying that all of the areas have been fully implemented, but arrangements are in place to capture what is required, with plans in place to ensure that all the individual strands that were highlighted are being taken forward. And there's a number of large pieces of work to take on board the outcomes. For example, you've quoted the MSG as part of the improvement plans and the arrangements that have been put in place with regard to the strategic plan also. But bear in mind, the last year, also there was no strategic plan in place for part of that, of the 18-19 year. It had run out. So there were some significant issues at this time last year, but I have received assurances, and from my knowledge of the organisation, I have a greater understanding of how those issues are being taken forward, and I've got assurances from that. Is there any part of the question that I've not dealt with adequately?
No, I think that's very helpful. I think there'll probably be more, or I'll certainly have more of a detailed follow-up in relation to the governance assurance statement, which comes later on in the agenda. But I wanted to be assured in my own mind that all of these things had been covered, as I knew they would be, and they would all be encapsulated in the opinion that you give in paragraph 5. So recognising stylistic differences, it was to provide that assurance that the substance was the same. Thank you.
Absolutely, most definitely.
Thanks. Thank you, Mr. Erskine, and I'll just bring the Chief Financial Officer in a moment. You referenced, as the Chief Internal Auditor has, the MSG and also other things that we were looking at in previous years, the joint inspection, the Audit Scotland's report, and all of those, as the Chief Internal Auditor has said, have now been wrapped up in the improvement plan, which replaced as well our previous transforming governance plans that used to come to the Audit and Performance Committee. And as you will remember, at a recent integration joint board, there was a discussion about how the Audit and Performance Committee, what our role would be monitoring that going forward. And the Chief Officer, despite all of the other pressures that have been ongoing at the moment, has brought together what I think is a very good way of our continuing to monitor that improvement plan actions, as you'll see later in the agenda. So just to give that additional assurance on that specific point. Chief Financial Officer.
Thanks, Chair. You've effectively covered what I was going to comment on, which is the huge amount of work that has gone on since inception of the IGB to, first of all, understand our governance arrangements and what they should look like, and then to work to ensure that we were improving areas where that was required, recognising that there is, in the early days there was no blueprint for integration joint boards, and we strived extremely hard to recognise our strengths, but really recognise our weaknesses, and that came forward first of all through our transforming governance action plans that came regularly to Audit and Performance Committee and with updates on progress, but more recently through bringing together those outstanding areas with the outcomes of the joint inspection and the MSG assessment into a partnership improvement plan, which a significant amount of work has gone in over the course of the last financial year to try to drive forward those key governance priorities. There's no doubt that has been impacted by COVID-19 in the latter months, but we'll come on to talk about that in relation to the Partnership Improvement Plan paper later on in the agenda.
Thank you very much for that, Chief Financial Officer. Mr. Erskine, are you happy with that, or did you have any further comments?
Thanks, Chair. No, I'm fine with that. Thank you.
Okay, thank you. Can I ask if there are any further questions on this report? No? Okay. Well, if that's the case, then I'll suggest that we note the contents of the report and specifically the audit opinion at section 5, if members are happy to agree. If people could say otherwise, if that's the case. Okay, I'll take that as agreement. If we move on now to item 5.2, which is the Internal Audit 2019-20 Progress Update and Internal Audit Reports. I think, Chief Internal Auditor, you did touch on this in your remarks in relation to the previous paper, but if there is anything else that you would like to add on progress. Thank you.
Thank you, Chair. Really, I'd just like to highlight there's 3 reports which will hopefully be presented at the next meeting of the Audit and Performance Committee in relation to the financial risks, the Partnership Improvement Plan, and also Performance Management, which are the 3 outstanding audits from 2019-20. As I said, work has already been substantial in those areas. Following the pause, the reports were not quite ready to be considered by management, but I'll be taking those ones forward. You'll certainly see reference within a future report at this committee to work that's been underway with regard to the improvement plan, and the work that internal audit has undertaken with regard to that on a consultancy style basis, and we would hope and anticipate that more work will be undertaken in that regard in a different way in the 2021 plan, subject to another report on this agenda at 5.6 being taken forward. So although there's no actual written reports at this point because of the pause, they are very much on stream and ready to be considered at the next meeting.
Thank you for that update, Chief Internal Auditor. Can I ask if members have any questions on that? Okay, I'll take that as a no, so thank you. We'll move on now to item 5.3, which is the Strategic Risk Management Update, and I'll ask the Chief Financial Officer to speak to this report. Thank you.
Thank you, Chair. The roadmap set out in Appendix 1 of the paper sets out our detailed plans to comprehensively update the IGB Strategic Risk Register. Over March and April, that work did commence, however, was then very significantly impacted by the COVID-19 pandemic. However, the report hopefully outlines the progress which we had made. Our initial work identified 12 strategic risks. The refreshed work that we did, set out those, I think, in a more clearly defined manner, that more carefully outlined the areas of focus and the mitigating actions that are required. It's worth noting that as part of those 12 risks that have been set out, 2 of these relate to specific service areas, and these are primary care and mental health. In relation to mental health, the recent changes in governance, will require us to apologies. The changes in the mental health governance arrangements will require us to go back and revisit the requirement for that risk to continue as a strategic risk in its own right. In relation to primary care, I'm sorry, Chair, I'm going to have to excuse myself and take a drink of water.
Okay, that's fine, Chief Financial Officer, if you want to take a few moments while we... can I ask if the Chief Officer wants to pick up on anything on this report in the interim?
So I could respond to any questions perhaps in the meantime while Jane's getting herself a drink of water. I was going to comment on the arrangements in relation to mental health, if there was any need for clarification in that regard. But that review has yet to take place. That review of the inclusion of a strategic risk within Perth and Kinross's Health and Social Care Partnership Strategic Risk Register has not yet taken place, because the operational responsibility for mental health services transferred to a new director in the NHS only last week. So that work still has to be undertaken. But as we've said earlier, and as I will be saying in respect of the next report, our ambitions and plans for how we were going to proceed over the spring and summer months have been severely curtailed by COVID. So the roadmap that's included as an appendix to this risk report, which we had began to undertake and progress with a a high level of motivation, engagement and commitment from executive team has obviously been stalled, and that's a position that we need to revisit in the context of our next phase of work. I see Jane's back and hopefully has removed the frog from her throat. You were talking then about primary care inclusion as a risk, Jane?
Yes, the executive management, well, sorry, first of all, apologies. Hopefully that's my throat back to normal. The executive management team identified 2 areas where the combination of different risks were such that we felt that the service area in its own right required to be brought onto the register. Mental health, as I said, will require revisiting, but for primary care, the combination of risks around workforce and availability of workforce, around premises and premises impact on service delivery, and financial in relation to the availability of funds to fully implement the GMS contract. The combination of the levels of risk felt that we needed to escalate the service area as a whole onto the risk register. And the further work that we'll now proceed to do, capacity permitting, we'll seek to bring forward those areas and the other areas listed in a full revised risk register to the September committee.
Okay, thank you, Chief Financial Officer. Can I ask members if they have any questions on anything raised in the report or in the updates? Okay, Mr. Erskine.
Thanks, Chair. Thanks for the report, Jane. It's great to see that. And I have some questions, I guess, that may already have been answered or I know will be in your mind. I guess the main concern I have around any report on risk where we are in the middle of the COVID pandemic just now is that the time that's taken to consider risk issues sometimes is quite limited, and I appreciate that's the case because of other priorities. However, I guess what I'm really looking for some assurance on, firstly, is that any major changes to any of the risks that we have identified or any new risks are taken into account, and any urgent actions that we need to take are being taken or are going to be taken in the future. So it's my first thought or question is in relation to the thinking around the changes in relation to the major risks that face the partnership. The second thought related to that, or question related to that, is if a bit more information could be provided on how we liaise with the Health Board, the Council, and if necessary other IGBs when we are thinking about risk, as I'm guessing there will be a degree of read across and tying up with other bodies in there. The third specific question on the Appendix 2 item itself, I note we've got priority colour system in there, and the first one, SR1 financial risk, is red, but none of the other risks are red. So perhaps a bit of explanation around why we think that is the biggest risk facing the partnership at the moment. Would that be a fair comment? That's what would be indicated, I think, by what we're seeing there. And finally, how COVID-19 related risks might be shown within that document. Either would they be integrated into the headings that we have just now, or is there an intention to have something that stands alone or is separate? So I appreciate a kind of review of urgent risk actions, the liaison with other bodies, risk 1 and COVID risks. That's my 4 questions. So I tried to keep them as concise as possible. Thanks.
Thank you. Chief Financial Officer.
Thank you. Hopefully I'll be able to respond logically. Can I first of all take your last question, if I may, Ronnie, in relation to COVID-19 risks? You'll see in the paper that we have developed a standalone risk register, and we had hoped that that would be sufficiently advanced to bring it forward to committee, and we're disappointed not to be able to do so today. We are at a stage where that will be regularly updated, and we're at a stage of actually asking ourselves that very same question. How will that risk register align or indeed combine with the standard risk reporting that we bring forward to the committee? And over the next 2 or 3 weeks, we will be working that through, and therefore I'm not able to give a clear response to how we will integrate the COVID-19 risk register with our overall risk reporting. If I can take your third question then, because it kind of ties in nicely, what we've presented in the paper today was the risk register as it was reported to the last auditing committee, and at that point financial risk was regarded as the most significant risk. That could have significantly changed, and the work that we need to do now between now and September is review all of our risks in relation to COVID-19 and what that means in terms of our risk scores across all of our services and our strategic delivery plan. So whilst it was the biggest risk in February, we will need to undertake further work to understand our risk profile and bring that forward in September. In terms of liaison with our parent bodies, there is a strong link, certainly in relation to risk and NHS Tayside. The Chief Officer is a member of the NHS Tayside Strategic Risk Group, and there's strong connections made there. Probably predominantly, and the issue of read across, you're absolutely right. There's 3 IJBs in NHS Tayside, and therefore NHS Tayside are keen to understand that read across. And it's helpful for us to understand the read across through that vehicle and that mechanism of the NHS Tayside Strategic Risk Group also. So that's a very helpful and supportive mechanism that we feed into. There isn't the same requirement from a Perth and Kinross Council perspective, but we very much work along with Lisa Simpson as Head of Risk to understand the read across with our risks and those of the Council, and that will be increasingly important as we move forward into the next phase of the COVID-19 response and renewal. I think, I'm not sure whether that you may need to repeat the very first question, Ronnie, if I haven't covered that in those 3 responses.
Mr. Erskine.
Thanks. Thanks. Just a couple of points on that, Jane. Very helpful to hear that. Firstly, I'll make a point for information. I'm involved fairly extensively in a risk review group for NHS Tayside, and there's going to be some discussion at the board meeting later this week on how we might review the way that risk is looked at, and also talk about changes to major risks faced by the health board. So I think there is definitely a link to the IJB in Perth and Kinross on that, and Gordon, I'm sure, will feed back on that. I'm not unduly concerned about the timing for the integration of COVID risk into the risk register. I'm involved in other bodies who are doing this in different ways, so I appreciate that there isn't one answer to this. What I would really be looking for assurance on, though, is rather than waiting until September, that and I know we've taken many actions as a health and social care partnership. The assurance I would be looking for is that we are actually thinking about what our priorities are in relation to the actions we take and the management of risk, and that we're quite comfortable that the priorities we're setting now in what we do operationally align quite nicely with the risks that we perceive. So if I can have some reassurance on that, more than seeing a completed document on a bit of paper, that's perhaps one for Gordon as well as Jane, but thank you.
Chief Financial Officer first then.
Yes, I think in terms of service delivery over the COVID period and beyond, one of the requirements of all health and social care partnerships across Scotland has been the setting out of a mobilisation plan both in terms of our initial response and now in terms of our recovery and then in terms of our renewal. And those detailed service actions that we're taking have been set out extremely clearly to ensure that discussions with the Scottish Government and with both partner bodies could be taken robustly and transparently and with a level of clarity about the actions that we have been taking to continue to deliver services. And it is exactly that the mobilisation plan that we are now linking to in terms of the COVID risk register, in terms of ensuring that what's set out in the mobilisation plan in its different stages responds directly to those high-level risks around financial sustainability, service delivery, clinical care governance, etc. So linking our mobilisation plan as it moves forward into its different iterations with our risk register is absolutely critical, and it's what we are currently working our way through. Gordon, I don't know if you want to say any more.
Jane, thank you for that. I think that's a comprehensive response. You've picked up on some of the things that I would have said. I suppose the only additional comment that I would make, building on Ronnie Erskine's earlier comment, was around the significant work that is underway in relation to our exposure to financial risk as a result of COVID. So Jane's alluded to the fact that we have a mobilisation plan. We have within that plan a significant exposure in relation to the additional costs that have been borne as a result of our response to COVID-19. We are engaged in discussions with the Scottish Government in relation to the submissions that we've made on a number of occasions in terms of whether or not they will cover that risk and provide reimbursement to the tune of several millions of pounds that we've got within our mobilisation plan. So that will continue to be an area of focus, and was a red risk on our register anyway because of the £4 million deficit we had last year in our budget from the start of the year, which has obviously been offset in relation to the additional investment that we received from Perth and Kinross Council this year. But we still have a deficit budget at the start of this year, and obviously there are changes in relation to things like the changed arrangements for the operational delivery of inpatient mental health services, which will have a bearing on our budget, potentially in a positive direction. But there are also other aspects that I know are around at the moment. For example, consideration being given to whether a GP practice in another part of Tayside should move to a 2C practice and what implications that might have for our budget. But the most significant and telling will inevitably be the costs that are borne as a result of our response to COVID, which are either direct expenditure to provide that response, a loss of income because we've not been able to charge for some services that haven't been being provided through COVID, or transformation plans where we had sought to achieve disinvestment as a result of strategic improvements and service improvements, and will not be able to deliver on those this year. So there's a lot of exposure in relation to the financial risk, and obviously we will do what we can to maintain up-to-date communication in that regard to the Audit and Performance and IJB members as and when that arises.
Thank you, Chief Officer. Can I ask if any other members have questions on this report?
Can I ask a question, Chair?
Yes, Mrs. Kilpatrick, apologies.
It's a bit tangential, but it's about risk, and it could be quite a major risk, and it's about how quickly we can get some kind of handle on this, and that is about the fallout in terms of service demand as a result of COVID. Because if we, I mean, I don't know if we've done any scenario planning to look at best case, worst case scenario, but even on a best case scenario of the people who've already had COVID who have recovered, a number of them will be elderly people with multiple comorbidities. That is likely to put a big demand, not just on healthcare, but on social care and ongoing intermediate home care, possibly nursing home care, as these patients, although they have survived their COVID-19 episode, will have serious health and social care needs. And I'm not sure if we've got any kind of handle on that, and we're probably not alone in that. I'm not even sure that the NHS board has got any handle on it yet, but it's something that I think could be a major risk to a health and social care partnership, and I think it does need some kind of forward planning, scenario planning, worst case, best case, and that would obviously affect prison health as well. So it's I don't know if we can answer the question, but I'm just raising it because it is, I think, an issue of risk and concern. Thank you.
I don't know who wants to answer that. Chief Officer, do you want to comment on that?
No, I think it's a really important and valid point that we are at the moment just impact assessing. We're scoping out what the implications might be. It may well be around the development of more extensive rehabilitation services and supports that are of longer duration than might otherwise have been the case because of the effects that COVID-19 has on numbers of our population, particularly perhaps our elderly population or people who have underlying conditions, respiratory conditions. So we are looking at what that means. It's factoring into our mobilisation plans. I can provide a degree of assurance that we are absolutely recognising the challenges that that's going to bring. What I am unfortunately unable to do is to say exactly whether we know what that will mean in practice and in reality, but we are monitoring it closely, and it features in a number of lines within our mobilisation plan as we recognise the longer term impacts that COVID will have.
Thank you, Chief Officer. Mrs. Kilpatrick, are you happy with that, or did you want to make any further comments on that?
No, I'm happy with that. I know it's early days, and it will be difficult, I think, to get a handle on it, but I think some sort of scenario planning, looking at best case, worst case, and what the financial impact and the service impact will be, Gordon, I think is going to be really important. So thank you for that.
Okay, thank you. Well, if there are no further questions, the recommendation in the report is that we note the progress in relation to the Perth and Kinross Health and Social Care Partnership strategic risk profile and the planned work by the risk steering group, including those references to the COVID-19 risk register that we talked about earlier on. Can I ask if members can indicate if they are not happy to agree to that recommendation? Okay, I shall take that as agreement, and we shall move on to item 5.4, which is the Partnership Improvement Plan, and I'll ask the Chief Officer to speak to this report. Thank you.
Thank you, Chair. I was just trying to locate my papers, so bear with me. Have it now. So the Partnership Improvement Plan report. I think we've touched on aspects of this as the meeting has progressed, as the committee has progressed. The Partnership Improvement Plan is one of those core documents that we had pulled together. Members will perhaps recall we had presented to the IJB in February on the Partnership Improvement Plan. It's really the vehicle for us bringing together the recommendations that have come forward from the Ministerial Strategic Group's self-evaluation on integration and the progress of integration. Our self-evaluation that supported the joint inspection and indeed the joint inspection report. And the findings from audit reports and our annual governance statement into a single document. We've developed this architecture, this framework, where we have identified the key improvements, recognising that there are some interdependencies and there are some overlaps in terms of the findings from each of these reports that I referenced into this Partnership Improvement Plan. Our ambition was that we would then absolutely, we recognised that pulling together the plan was not was the beginning rather than the end of that journey, and all it was a vehicle to enable us to then identify who the responsible officers were, identify what the timescales were in relation to the actions that we had agreed, and to advance those with pace where we could, and to continue to report either to the Audit and Performance Committee or to the IGB. Indeed, to report to the executive management team, and for it to be a challenge to the executive management team to deliver the necessary improvements that we had all set out and agreed were necessary. Like so much of what we've discussed today, the expected progression in relation to the Partnership Improvement Plan has been stalled as a consequence of COVID. If we anticipate that on the 12th of February, the IGB considered this report, the Partnership Improvement Plan, and then by the end of the following month we were in lockdown and dealing with significant challenges around COVID. Members will perhaps appreciate that we haven't made the progress that we would have liked in this regard. However, we have attached the current iteration of the Partnership Improvement Plan to the report as appendix, and this reminds committee of those areas that we have given a commitment that we will now work on, or that we had given a commitment we will work on, and that we will now be reviewing, refreshing, reprioritising, hopefully updating some of the risk status in relation to the right-hand column. But in some situations we may also have to be saying, in light of what we're now facing, this has to be deprioritised, and our activities need to be focused on other aspects of the plan. I'm hoping that members will have had the opportunity to consider this paper and would be happy to take any questions rather than say any more at this stage.
Thank you, Chief Officer, and I'll ask members again to indicate if they would like to ask a question on this. I would first just like to say thank you to the Chief Officer for bringing this together. I know there was some discussion about what was the best format to report to the Audit and Performance Committee, and I made some comments, as did others, and I think this is a good way of ensuring that we can continue to monitor the actions that are presented and need to be progressed without going into the operational detail. The only comment I think I had, which I said was fine to be brought forward to the next committee, was perhaps that in addition to the RAG ratings, we could also have some actual expected completion dates and where things are in terms of being on track or not. But that's the only comment that I would make at the start. Mr. Erskine, you have a question.
Thank you. Thanks, Chair. Thanks. It's great to see all this pulled together. It's very helpful. I would say certainly the last few months obviously mean it's been more difficult to progress some of the development within the plan and the actions within the plan. But I do think I'm a bit concerned that it seems to have taken a year from the recommendation to prepare a plan for a plan to be produced. So my first question would be around that area, and I appreciate that issues have happened through the year as well that have been integrated into the performance improvement plan as well. But given that this is a key work plan for the organisation, I think some assurance on future progress would be helpful. Linked to that, mentioned in here are issues relating to corporate support and staffing. So it may be that the Chief Officer might want to address that in response. Do we feel there is sufficient level of staffing to progress the actions in the plan? The third question I would have in relation to the document, I think that paragraph 3.3 on assurance is absolutely critical for the Audit and Performance Committee. I would really be looking for that assurance from internal audit as soon as that can be delivered. I think that's really quite important for this body. Now, I also have 2 or 3 questions on the plan itself, quite short and brief questions. So I'll mention these. Firstly, on IP1, how effective is the IGB? There are self-assessment documents out there. The Treasury handbook, the Audit and Assurance handbook, for example, from the Scottish Government, that have self-assessment questions that could perhaps be modified there. So it might be helpful to see if we could, rather than reinvent something, use what's there, and perhaps progress that, given that it's a red. The second question I had in relation to IJB member development, really a specific on IP4. I'd have to say my experience of induction has not been good in the last 5 months. So I would be hoping that when we take that forward, that we're able to improve the quality of induction for new and existing IJB members. I still feel I'm learning as I go along from venerable members of the committee and senior staff, but there are still some gaps there. And finally, I just wanted to understand IP27, which support NHS Tayside to ensure timely agreement of the budgets, and that's in as a green. I'm not sure exactly what that means, so perhaps if clarification on that could be provided, that would be really helpful. Thanks.
Thank you, Mr. Erskine. Just very briefly to pick up on your second to last point, the Audit and Performance Committee last year did do a self-assessment against the Scottish Government's Audit and Assurance Handbook, and the intention was to do that again this year and to bring it to this committee. We just haven't been able to pull that together. So that's certainly our intention to do that, hopefully for the next committee, in terms of the audit and governance assurance functions that this committee provides for the whole Integration Joint Board. Obviously, there are other aspects to your question, but just on that specific point, I wanted to give you that assurance that we had done that before, and I agree with your comments on that issue. Okay, the Chief Officer, do you want to take those questions?
Thank you. Yeah, so I suppose this is the latest iteration of a summary of the Partnership Improvement Plan that was developed in response to the various publications. So I'm not sure it's taken a year to get to this stage. We know that the inspection findings were received by the partnership in September last year, and were a key part of our analysis and collation of the information that is contained within the Partnership Improvement Plan. And the Ministerial Strategic Group self-evaluation took place in May last year, but it was then updated a few months later and resubmitted to Scottish Government, and an action plan fell from that. So we accept that we don't always deliver with the pace that we would like to, and sometimes that's because we don't have the ability to prioritise some of the activities that the committee may wish us to deliver on, because our focus has been on seeking to try to deliver and sustain services, which is a nod to the second question around staffing capacity. We have a dearth of staffing in relation to, a dearth is probably not the right phrase. We have a recognised need to enhance the capacity that exists, and work has been underway in relation to potentially looking at restructuring the Health and Social Care Partnership from the beginning of this year within the available resources, which is a bit of a challenge, because we would prefer to be committing our expenditure, which is greater than our budget, to the direct provision of services and ensuring that we can sustain health and social care community services for the people of Perth and Kinross. But there is a need for us to reflect on how we can better resource our corporate support around clinical and care governance, around planning, around performance, around improvement, around organisational and workforce development, around communications. We need to find a resource that enables us to fund that necessary corporate capacity. In relation to specific questions around the plan, so some of these are recognising that the Ministerial Strategic Group and probably the Joint Inspection, as well as the Audit and the Annual Governance Statement, recognise that a number of these actions, a number of these areas for improvement are contingent on the contribution of statutory partners or of other players. That there are clear interdependencies between what we are able to do and what we are enabled to do, what we're funded to do, and how we can deliver it. Some of the actions within the improvement plan do require us to be engaging with colleagues across statutory organisations, statutory partner organisations, to try to give effect to how we can secure that improvement. Some of it also relates to how we can ensure that we support the chair of the IGB in terms of his engagement with members of the IGB, particularly in thinking about addressing some of the deficit you've identified around the support that might be needed to IGB members to better understand their role and contribute as effectively as they can. Something about induction, but something also about 360 feedback, about development plans for IGB members, about aggregating that into a training and development offer that we can make. And I know the chair has begun to have discussions with IGB members around some of that, and we would wish to expand on that. But certainly, I take your point and recognise the point around the limitations of our induction programme. I apologise for that. We had anticipated that for new members and for existing members, the development sessions that we had set up, firstly with David Williams, and beyond that, in terms of anticipating that we would provide input to IGB members on particular areas of service delivery and development, would have gone some way to support members, but obviously that hasn't satisfied people's expectations, including our own, in terms of what we would have liked to have done. We will take a view on that, reflect on that, and see what else we can do in order to try to ensure that IGB members are able to feel that they are better understanding their role, better able to contribute, and able to apply the scrutiny that is required in order to be assured to the degree that they would wish. The final point about IP27, I shall perhaps ask Jane if she would mind refreshing my recollection as to where that came from and why it was incorporated. Certainly it reflects the fact that our ambition had been to try to synchronise the budget planning activity that exists across two statutory partners. You know, when we compare the timescales, they aren't in sync, but that recognises the fact that the funding that they're receiving from government perhaps arrives at different times, but certainly also the process. So we had a number of budget review group meetings with council elected members before the budget was set and agreed. I had the opportunity to highlight some of the activity that was underway, the demand pressures, the demography, the transformation plans that we delivered on, and the challenges facing us, which enabled the council to award a 10% uplift to our budget for the second year running. The discussions with NHS board are really in and around CFO to CFO and consideration that the NHS assigns the budget that's allocated by government, which perhaps arrives later in the day. So I think it was an attempt to try to take the best of both those arrangements and develop an approach that satisfied both statutory partners and ourselves and yourselves as IGB members. Jane, would you wish to add anything to that which I've just outlined?
Thanks, Gordon. Yeah, just to supplement that slightly, the MSG self-assessment process that was required of us by Scottish Government wasn't just for the Health and Social Care Partnership to complete. We were to complete that in conjunction with our statutory partners, and we did that. And in the self-assessment in relation to budget, the Scottish Government asked us, do we set our budgets before the 31st of March? And in relation to NHS Tayside, for a number of years, that hasn't been the case. The NHS Tayside have certainly been moving towards trying to do that, and our discussions with the Director of Finance have been very positive in terms of his intention to recognise that need. However, in terms of how we've included that in the improvement plan, it's something we can support and it's something we can try to influence, but it's not something that we can action. So the action is actually one for NHST side, and all we can do is help to support them in terms of the information that we provide in our financial plan, rather than something that we can directly action ourselves.
Thank you, Chief Financial Officer. Did you want to comment more generally? I think you said earlier on that you wanted to comment on some of the points that were made.
Okay.
No, I suppose I just wanted to confirm what Gordon said around the Partnership Improvement Plan itself. This may be the first time it's coming forward to the Audit and Performance Committee, but colleagues will remember that we brought a paper to an IGB, I think in February, which outlined the Partnership Improvement Plan process. So this is an iteration. This has been in place for a number of months now, and I think the different discussions around whether or not it should come to the Audit and Performance Committee at all is the only reason why we're seeing it now, not because this is the first month.
Okay, thank you. Mr. Erskine, did you want to make some further comments there? We're just losing the Chief Financial Officer's sound towards the end of that, I think.
Yes, I think, thank you, Chair. Picked up the gist of that. It was certainly reassuring to hear about the progress over the last year, and given a few gaps in my knowledge in relation to the development of the Performance Improvement Plan, it's helpful to hear that. The only specific point really was on that finance action. It seems a bit of an odd action to include in the plan. And I don't want to start talking about detailed actions, but one of the issues that isn't in there is the reconciliation of a 3-year budget approach with an annual budget approach, as well as meeting a 31st March deadline and resolving risk sharing. These are the 3 big things for me in finance. So no doubt for another day, but thank you for the comments.
Okay, thank you, Mr. Erskine. I'll now bring in Councillor Duff, who had a comment, I think, on the appendix of the report with the improvement plan. Councillor Duff.
Thanks, Chair. Yeah, no, it was just a comment about the kind of visual appearance of the plan. Not sure if it's the Audit and Performance Committee's role to do. It was just a comment. Obviously, there's a connection, if you like, between the priority level that a risk or an action is given and its current RAG status, and obviously they're at either side of the thing, and I think they might be better if they were together. So you could see the priority 1s, which are red, and the priority 3s, which were red as well. So obviously it was just a comment in terms of how to read the plan. It might be easier visually to see these 2 columns together. And also in terms of the progress of the plan, improving or not, it might be helpful to see a kind of summary table at the end which tells you how many green, red, amber actions there are and how many there were before, just so you can see that a number of them are moving from red to amber to green or whatever. So it's just an interpretation thing that might help as we go ahead looking at these things. That's just a comment.
Thank you very much for those comments, Councillor Duff, which I endorse as well. And perhaps if the Chief Officer is content with this, that if any members have any further comments that they want to pass on to the Chief Officer in relation to the format of the report for a future meeting of the Audit and Performance Committee, that perhaps they get in touch with you directly, notwithstanding the fact that obviously there are other pressures at the moment, if that's okay.
Indeed.
Yeah.
Okay, can I ask if there are any further questions, and also if Mrs. Kilpatrick had anything that she wanted to add? No, okay, I'll take that as everyone is content with the report. So the recommendation is simply to note the progress of the Partnership Improvement Plan, and as I said, if anyone has any further comments, then to make them directly to the Chief Officer. Can I ask if there's anyone who does not support that recommendation? Okay, I'll take that as agreement. If we move on now to item 5.5, which is the audit recommendations update, and I'll ask the Chief Financial Officer to give us an update on that. Thank you.
Thank you, Chair. In line with best practice, the Audit Committee requires to make a recommendation to the IJB around appropriate audit arrangements in place for each financial year. This paper recommends to the IJB the reappointment of Jackie Clark as Chief Internal Auditor for a further year, and the joint arrangement of the Perth and Kinross Council Internal Audit and Tayside and Forth Valley Internal Audit Service. And we believe that this will provide well-needed consistency over the financial year ahead.
Sorry, it was just to check, Chief Financial Officer, whether there was anything on 5.5 specifically first in relation to the audit recommendations update. I know we don't have a paper, but just if you
sorry if I jumped ahead.
Okay.
Apologies, Chair. In relation to 5.5 audit recommendations, we brought the paper to the last committee. It's not subsequently been updated due to pressures, workload pressures in relation to COVID-19. At that time, there were 6 recommendations outstanding, of which 2 were agreed as complete. So 4 recommendations currently outstanding. 2 of those relate to issues relating to inpatient mental health, which may subsequently fall away due to the change in governance arrangements, and 2 relate to strategic delivery plans being brought forward. And again, those may well need to be revisited in light of the current mobilisation plan work that we're doing. However, we will bring those forward to the next committee. Apologies.
Okay, thank you for that, Chief Financial Officer. Do any members have any questions on that update? No. Okay. So the next item is item 5.6, which we've already touched on. Are there any further comments you wanted to make on the appointment of the internal auditors for 2020-2021? Any questions from members on that? Mr. Erskine.
Thanks, Chair. It's not a question, it's just the purpose of report heading has 2019-20 in it, and it should be 2021, I think, at the top of the paper.
Okay, thank you for pointing that out. In the purpose of the report section, it's different from the heading. Okay, that's good, thank you. Are there any further questions or comments that anyone has on the appointment of the internal auditors? Okay, are we therefore happy to approve the appointment of Jackie Clark as Chief Internal Auditor and approve Perth and Kinross Council Internal Audit Services and FTF as the IJB's internal auditors for the year 2020-2021? If any members disagree with that recommendation, could they please indicate? I'm just giving ample time, so I can't be accused of pushing anything through. Okay, that's fine then. I'll take that as agreement from members to those recommendations. Thank you. Right, that concludes the section on governance and assurance. If we move on now to section 6 of today's agenda, which is the draft annual accounts for 2019-2020. And the first item in this section of the agenda is item 6.1, which is the annual governance statement. And I'll ask the Chief Financial Officer to speak to this report. Thank you.
Thank you, Chair. The annual review of governance provides an opportunity to review all of the rules, resources, systems, processes, culture and values to make sure that the framework surrounding delivery of strategic objectives is fit for purpose. And despite all of the challenging circumstances we've faced over the last 3 months, we have undertaken a broad assessment, including the changes to governance arrangements actually required in response to COVID-19. Our review for 1920 has been significantly supported by the Partnership Improvement Plan, which does give clear evidence of areas of progress, as well as identifying the areas of weakness that continue to be taken forward. There is no question that the COVID-19 pandemic has impacted on progress in a number of areas, and resources will require to be realigned to make sure those most significant areas can be taken forward, as we've discussed under the previous headings. The annual governance statement itself sets out the governance arrangements that are in place and the system of internal control, and they're set out in line with the SIPFA Good Governance Framework cornerstones. In addition, the annual governance statement sets out, as I said, the specific governance arrangements that have had to be implemented in rapid speed to respond to the COVID-19 pandemic. Reliance is placed on NHS Tayside and Perth and Kinross Council systems of internal control, and we await the assurance from both partner bodies in relation to the effectiveness of their own governance frameworks, and that will be brought forward to the September committee. There were 2 further points I wanted just to mention. One is in relation to inpatient mental health and the change in governance arrangements that arise from the ministerial announcement that has subsequently been implemented from the 17th of June. At this stage, therefore, the annual governance statement makes no reference to those governance changes on the basis that they take place in the next financial year. I just wanted to highlight the changes to governance that have been made in response to COVID-19 specifically, and those have been the immediate requirement for a new command structure, which is still in operation and to which the whole executive management team are attending on a twice-weekly basis, as well as attending the command structure meetings of both partner bodies. So that continues to be a key governance arrangement that will support us in what are still challenging months ahead. In relation to our almost instantaneous development of a workforce matching unit, to make sure that the workforce resources that we had, which were challenged over the key months of the COVID pandemic and continue to require significant review and alignment to ensure that critical services have been able to be delivered through the movement of workforce, and thereby avoiding significant additional workforce costs. So that's been a significant and ongoing change to our governance arrangements. The development of the mobilisation plan has been also a key and ongoing additional requirement for the partnership, and the work that we need to do now in understanding how the mobilisation plan fits against our strategic objectives is a core challenge that we face moving forward, and alignment of resources of the partnership to ensure that we can come back both to the IGB and in the future to the Audit and Performance Committee to make sure that we have agreed priorities in relation to delivery of strategic plan objectives through the lens of COVID. So the conclusion of the annual governance statement, is that we have the sufficient internal controls and governance framework in place, despite it being certainly a challenging last 2 months of the year. And I'm happy to take any detailed questions that members have in relation to those governance arrangements and the improvements that we've set out are still required.
Thank you for that, Chief Financial Officer. Can I ask members to indicate if they want to ask a question on this? Okay, I'll go first to Mr. Erskine.
Thanks, Chair, and thanks, Jane. I think I may have put my cue in twice there, but I think I'm following on a little bit from the comments around the internal audit report from earlier on. And 1.2 in this document, again, quite clearly sets out the purpose as being to give assurance to stakeholders around effective governance arrangements, which I think is helpful to see. But I just wonder if we have sufficiently covered in this report the concerns that were raised in the 18-19 internal audit plan, and also the exercises that have been in papers that the committee has received over the course of the 19-20 year. I appreciate there is some text on this inside the paper, and I'll come on to that just in a little second, if I can find it, which I think is in page 50. Yeah, at the start, I think. Yeah, it talks in some brief form around some of the performance improvement measures that have been put in place. I just wonder if that sufficiently addresses some of the issues raised over the last year, given the seriousness of those issues. Not so much on COVID, which really arose right at the end of the year, and we must remember this statement is provided as at 31st of March and not now. I would be wondering if there might be some comment on mental health in there, which arose as an issue later on in the year. So my general, I guess, concern about this is perhaps we don't cover those issues in the way that we've addressed these issues as an organisation sufficiently in the paper. I've got two other lesser points. One mentioned earlier today around the development programme and induction for members. I think in page 52 in the PDF under leadership, culture and values, we talk about a development programme being in place. And then again in page 54 under organisational development, IGB members are supported by a programme of training and development. I would question whether there is a programme of training and development, so I feel that's perhaps providing a bit too much assurance there. In the 5 months that I've been on the IGB, I can recall 2 events that I would class as induction, training or development. So I think there's perhaps a little bit more that could still be done on that area. So I think really just those 2 points for me, the first one being more substantive, the second one being a lesser point, and I'll leave it at that. Thank you.
Thank you. Chief Financial Officer, do you want to answer those questions?
In relation to the 2 specific issues that you've raised, Ronnie, in terms of performance reporting, I think was the first issue where you've asked for more specific assurance around the progress that we've made. And the audit committee in February received the first of what was to be a quarterly report, which was to significantly changed the robustness of our performance reporting. And whilst that was has been only one report, and I acknowledge that, in itself should provide a level of assurance around a move to robust performance reporting. Our full intention was to have brought forward a second quarter's report to this meeting, and the extraordinary circumstances have meant that that's not been possible, and therefore we haven't been able to sustain the performance reporting in line with our absolute intention, and that is unfortunate, and therefore in terms of level of assurance, it requires to come from that report and our commitment to build on that moving forward. In relation to mental health, Gordon may wish to comment, but the governance arrangements around mental health and what they mean for us moving forward. I'm not exactly sure what you mean in terms of the issues in 1819. I acknowledge that we now have a task ahead to understand what the new arrangements were, but in terms of the previous governance arrangements around inpatient mental health, they have been relatively clear, albeit not perhaps working in a way that we progressed strategic objectives sufficiently. So I don't know if there's anything, if you could clarify in relation to mental health, maybe able to answer that more specifically. In relation to the development of members, I absolutely recognise that there is a difference between what we set out in the annual governance statement, which is the basic delivery of a level of support to our members, which we've done through a number of the budget review group sessions, which provides quite a safe space for development in relation to financial risk and financial management, in relation to a number of visits that we've organised for our members, in relation to the development session that David Williams has provided. Now, these are general sessions, and I completely understand that that's not a tailored induction for specific members. I absolutely acknowledge that, but so too does the Partnership Improvement Plan acknowledge that we've got work to do in relation to induction and member development, and we don't shy away from that requirement. But it's that difference between, we are providing a basic level, and I acknowledge that basic level may be very basic, but it is there, but we've got significantly further work to do to make that the best practice.
Yeah, Mr. Erskine, did you have any further comments that you wanted to make?
Yes, thank you. Perhaps haven't articulated some of that question perhaps quite clearly enough. On the latter point around development induction, I do appreciate efforts have been made there. Reading the statement, though, that you would not particularly get that impression that there was work still to be done there. I think the statement generally is a little bit rose-tinted, and it does not focus on some of the things that perhaps we could, for example, on the performance issues and the progress made on those, which is welcome. It's whether there is a sufficiency of progress there to allow us to approve this document, which is what we're being asked to do under this agenda item. So I'm expressing explicitly my concerns around whether I'm able to do that at the moment based on the information that's in this document, and fully recognising the delay in relation to COVID-19 and the performance improvement plan work that may have come back to this committee. This is nevertheless one of the most significant documents that comes in front of audit and performance, or any audit and performance committee. So I want to make sure these issues are out in the open. So the issue for me is more around progress. On mental health, it was more around, again, I am coming to this relatively new in 2020, but the mental health issues, I believe, have been around for quite some time, and I may have, I'm not expressing governance issues on mental health. It's more whether there's any space in this report to comment on any of the actions that might be taken on mental health and any of the concerns that may have been expressed in previous reports. Maybe that's operational, maybe it's not governance or assurance, so I'm not making a big issue of that. My main concern more is around that progress update and whether we are evidencing, which is what audit and performance I think needs to see, are we evidencing the progress we've made since the issues were raised in last summer's audit plan and also through MGS and other reports. And I think if this document was updated to reflect progress more substantively, I would feel a bit more comfortable about approving it. Thanks.
Thank you, Mr. Erskine. Chief Financial Officer, did you want to make any further comments in relation to the points that Mr. Erskine has raised?
I absolutely acknowledge the issues that Ronnie's raising, and I'd be very happy to pull out more succinctly areas of progress if that were felt as required. In relation to the second section of the annual governance statement, where we clearly set out those areas where we still have weakness, whilst on one hand in the first section of the AGS we talk about a basic level of, for example, induction and member development, we do then go on to acknowledge in the second half of the annual governance statement that it is still incumbent on us to refresh the induction and review and refresh the annual training and development plan. So we're not in any way trying to shy away from the further gaps that we have, and indeed in bringing forward the Partnership Improvement Plan in public to this meeting, we are keen to be as transparent as possible about those gaps and the need to ensure sufficient corporate capacity to allow us to drive those forward. But if members believe that we need to further articulate some of the progress and perhaps rebalance particular areas such as member training development and induction, and I'm happy to revisit that.
Thank you, Chief Financial Officer. Can I ask if any other members have either questions or comments on the report, or indeed more specifically if they have any views on the points that Mr. Erskine has made? No? Mrs. Kilpatrick on the phone? Okay, just to ask Mr. Erskine, what's your thinking in terms of approving the governance statement today then? Would you prefer that we approved it provisionally with an undertaking that some of the points that you have made are addressed and included, or for them to be looked at going forward, or are you more of a mind that we should defer it to be agreed in writing after the meeting, because obviously there is a time pressure in terms of submitting the draft annual account, so it can't be left till September, for example. If you just want to maybe outline what your thinking is on that.
Yes, thanks, Chair. I'm not sure if Pat Kilpatrick is still there, but it was greyed out when I had a look at the. Oh, you're still there.
Can you hear me? No, yes, because I had a point about mental health, but I don't think the chairman could hear me.
Sorry about that. Was that in relation to this paper or a previous paper?
No, it was in relation to this paper, and it's not necessarily an issue I think that might need to be incorporated in the report, but it's just a general concern that I have, that I don't think that we're entirely clear what the new governance arrangements are for mental health, and I don't think we need to necessarily have to reflect that in this report. So maybe not specific to this agenda item, but it's an AOCB really, Chairman, but it just happened to have come up at this point in time.
Okay, and just on that point, Mrs. Kilpatrick, to acknowledge that there is an outstanding action for the Chief Officer to bring back to the full Integration Joint Board some greater clarity on what those governance arrangements are going forward, which was agreed as part of the wider motion that we agreed in February. I think it was supposed to come back to the meeting in June, but obviously that's now been delayed till July. So I would hope that, and I don't know whether the Chief Officer wants to comment on this, but that we could get an update on that at the meeting that I think is going to be on the 31st of July now. So
certainly we can either give an update in relation to the changes that have been initiated recently under any other business, or during this meeting in relation to the operational oversight of some mental health services. I would need to be reminded in relation to the outstanding point that you've just referred to, Chair, that arose in relation to mental health at an earlier IJB. Inevitably that will be captured in the action points, or I can get from the minutes. Not necessarily aware of what that might have been.
It was in relation to the report, the final report of the independent inquiry and the motion that was agreed by the IGB following that. There was a range of actions, including the future role of the Mental Health Alliance or whatever body that succeeded that, and also just a general undertaking by you to give greater clarity on the governance arrangements for implementing the improvement actions, which I think clearly encapsulates some of what Mrs Kilpatrick was raising, although that's something that has come additionally from the Scottish Government. But if that could maybe be covered in July, if possible.
Yeah, okay, yes. No, I've got that, that's fine.
Okay, now if I return to Mr Erskine, sorry, on the points that we were discussing in terms of the actual decision as to whether we agree that the governance statement today, if you had any further thoughts on that.
Thanks, Chair. I haven't forgotten the question, I think, and it was clearly set out in terms of what actions we need to take. I accept Jane's point in relation to the induction and development elsewhere in the document. That's fine. I go back to page 52. I think that's where we have a paragraph in there around, it starts further, we have developed a comprehensive improvement plan, and there's 4 lines in there. That's the section I feel in terms of providing additional assurance that it would be helpful to be expanded to take into account the points mentioned in that paragraph, and also the major actions from the internal audit plan from last summer. In some way, not every single item or every bullet, but extracting out the key points and mapping across what we have done either during 1920 or what we intend to do as part of the performance improvement plan going forward. So I would appreciate that being expanded in some way, and would be comfortable signing off the document once that has been done. I'm conscious that external audit can start prior to the approval of this governance statement, but certainly it isn't possible to sign off the accounts without the statement being approved. So there is a short-term time imperative here. So I'm not quite sure what the best process is here, if this could be modified in a relatively short period of time, recirculated and then signed off. I don't think another meeting to deal with that would be fruitful.
Okay, thank you, Mr Erskine. Well, I'm happy to agree to that suggestion if the Chief Financial Officer thinks that's something that is feasible, agreeing the broad principle and contents of the report, but asking for those updates and changes to be made, and then for it to be circulated to members for us to sign off on. Chief Financial Officer, do you want to set out whether you think that's an appropriate course of action?
I may need to speak to Ronnie after the meeting to just agree exactly how we're going to meet the requirements as he's set out. On page 57 of the papers, we specifically pull out the progress that's been made against specific areas of concern raised in the previous year's annual governance review. They're specific. I mean, they're not in any way all of the items, but they're the priority items that have been pulled out to give a sense of the progress that has been made. If what we're saying is we need that to be more granular and more detailed, then we can have a look at doing that.
Okay, thank you, Chief Financial Officer. Well then, if I could just first check if there are any further questions or comments from members or anyone else in attendance on the annual governance statement before I proceed. Okay, taking that as there are no further questions, what I'm going to suggest is then, just as we've outlined, that we agree in principle the annual governance statement and the general contents that is within it, that further changes are made in relation to some of the points that Mr Erskine has raised, and if necessary, Mr Erskine has a further discussion with the Chief Financial Officer to clarify those, that updated annual governance statement is then circulated to all voting members of the Audit and Performance Committee as soon as practicably possible following that, for us to agree in writing following this meeting. So I'll first ask if there's anyone who does not agree with that and would like to propose something else, if they could indicate. Okay, I'll take that, therefore, that we have agreement with that updated recommendation as I have set out, and we'll move forward on that basis, if that's okay. Right, thank you for that. If we move on now to item 6.2, which is the unaudited annual accounts, and I'll ask the Chief Financial Officer to speak to this report. Thank you.
Chair, I wonder if I could just ask for a 5-minute break before we proceed to this next paper.
Yes, that's no problem at all. We can have a 5-minute recess and then proceed if other members are content with that. Okay, back at 10 past noon then. Okay,
Thank you, Chair.
Thank you. And just to remind members at the moment that we are still live, so that if people could mute themselves and switch off their cameras for the duration of the recess. Okay, that is 10 past noon, so I'll just check first that the Chief Financial Officer is back. She is?
Yes.
Okay, well, in that case, if we can have item 6.2, the unaudited annual accounts, Chief Financial Officer, to introduce this paper.
Thank you, Chair. Just before starting, can I just take the opportunity to say a huge thank you to Donna Mitchell, my finance manager, and the finance team in the integrated in the partnership, who under immense pressure over the last few months have pulled together the annual accounts in extremely difficult circumstances. The finance team in the early part of COVID-19 were actually taken off their finance duties and asked to support workforce matching and redeployment for a number of weeks. And despite that, they have been able to meet all statutory deadlines associated with the annual accounts, and I'm very, very grateful to them for that. On page 66 of the annual accounts, the contents are set out, and for the purposes of today's meeting, I just want to touch on, first of all, the management commentary and the statements themselves at section 5. In relation to the management commentary, this provides an opportunity to look back over not just our financial performance, which we've covered earlier on in the meeting, but our general performance against the service objectives across our range of services. And those are set out, and our achievements are set out. Looking forward, this is an extraordinary period we've been through, and our ability to look forward and understand what we're facing is very, very challenging at the moment. And in terms of the management commentary, we have tried to give a sense of the extraordinary circumstances that we face in terms of predicting the impact of COVID-19 on our service delivery and on the financial implications and financial sustainability of Perth and Kinross IJB. And we won't be alone in that respect. That will be a commentary that's set out in management commentaries of all public bodies as they seek to understand the impact of COVID-19. The annual governance statement, just touch on, we've just discussed that and discussed the actions that will be required over the next few days to allow that to be embedded in the annual accounts. But in terms of the financial statements themselves, the income and expenditure statement, the movement and reserve statement, and the balance sheet, I'm actually going to ask Donna Mitchell to take members through the key issues arising within the financial statement.
Thank you, Chief Financial Officer.
I would just like to be able to take you through two of the areas within the financial statements, and then I'm happy to answer any questions that you may have.
Sorry, I can't hear Donna.
Yeah.
You're very quiet. Do you want maybe, I don't know, a bit closer to the microphone, or?
I'll certainly try. Is that any better? Not great.
Chair, it might be our audio settings, perhaps she needs to adjust the device settings.
Are officers able to put an individual microphone up in terms of the audio level?
Now,
Try again.
can you hear me now?
Yes, that's a lot better.
Okay, sorry about that.
No problem.
I'll be looking to take you through two of the areas within the financial statements, and then happy to answer any questions that you may have over any of the areas. Firstly, I ask you to look at page 19 of the appendix. So that's page 19 of the annual accounts, and it's headed section 5. In the start of this section, you will see the comprehensive income and expenditure statement. And what this statement does is it provides you with a breakdown of the net expenditure by each service. And you'll see the total cost of 215 million. I would just like to refer to the Chief Finance Officer's earlier
paper around the financial position, and just wanted to highlight that there's different treatment within the financial position that we're all familiar with, and the way that it's treated within the income and expenditure statement. So you'll note that there's a 1311 figure in the surplus or deficit, and that figure relates to the amount that has been spent from earmarked reserves within the financial year of 1920. That doesn't reflect the overspend that you've seen in the previous paper, and I just wanted to make it clear that it's just a different treatment, a different presentation of how we transfer from financial reporting into actual annual accounts. I would then take you on to page 26 of the annual accounts, and this is headed up Note 6. This is in fact the movement in reserves. This is the reserves statement. I'm just going to that myself. And you'll see in that one again, at the bottom and the middle column, you'll see that figure of 1311. And what that tells you is that for all the earmarked reserves that we had at the opening of 2019-20, we had a total balance opening at 2,470,000. We have utilised 1,311,000, and therefore we have a balance within earmarked reserves of 1,159,000. And I was just quite keen for everyone to understand that there was a different presentation between the financial reporting and the overspend that's discussed in there, and how that transfers into the annual accounts, and that the figure that you see in the previous income and expenditure deficit of 1311, that entirely relates to how we have spent the earmarked reserves in that financial year. I'm happy to take any questions anyone might have.
Okay, thank you very much for that, Ms Mitchell, and also the clarity, as I know that there was some discussion and indeed comment in the press about the reserves, and I think it's very important to be explicit that all of the earmarked reserves have been used for the purposes for which they were earmarked, and to reiterate that point. Just first, before I invite people to ask any questions, I'd also like to associate myself and I'm sure the other members of the committee with the comments that the Chief Financial Officer made at the start of this report, in thanking the finance team and in particular Donna Mitchell for their work on bringing together these annual accounts. But with that said, I shall invite Mr Erskine to ask the first question on the draft annual accounts. Mr Erskine.
Thanks, Chair, and I know you've said it as well, but I do wanted to commend the team. This has not been an easy year, and I know other organisations have not made the progress that the IJB has, so well done to all involved. Actually, the main question I had related to that table on reserves, and it was around the fact that we have used up some of the reserves, a fair chunk of them during the year, and are there any of those particular earmarked reserved areas that we feel we may be struggling to fund in this year and years ahead? I'm conscious there's been some fairly big draws in some of the funds in there. The second question I had, jumping back to page 71, if I can find it on my own screen, it's a comment that was made in here around the 3-year financial recovery plan, setting out this anticipated shift in resources from bed-based to community. Could we maybe get an update on that, on how that aligns with any NHS Tayside plans? And the final point was really just a typo, a very minor typo on page 74, halfway down the page, just at the word Scottish Government. I think there's a word missing in that sentence, so it's the paragraph beginning predicting, so a very minor point on a typo. But thanks again.
Thank you, Mr Erskine. Ms Mitchell, did you want to pick up on any of those points that were raised?
Jane, are you happy to answer the questions, or?
Yeah, I can take them, Donna, thank you.
Okay, Chief Financial Officer.
Yeah, so in relation to the utilisation of reserves, as we have very clearly and categorically stated, those reserves are all earmarked reserves being carried forward to meet future spending commitments to support future service delivery. Through the eyes of COVID-19, we examine utilisation of these reserves as they're currently aligned to ensure that they are within that service area, whether it's mental health, drug and alcohol.
Sorry, Chief Financial Officer, it's very difficult to hear. Your connection seems to be breaking up. Do you want to give it a minute and then we'll try again? I don't know if other members are feeling the same, but I couldn't entirely understand what was being said. Okay, do you want to give it another go?
Is that any better, Chair?
Yeah.
Shall I try again?
Yeah, it seems to be a bit of a stronger connection.
Okay, so the reserves that we are carrying forward, our 1.3 million, are fully earmarked against a number of different services. What we will do as part of all of our work to understand the impact of COVID is to make sure that for those different service investments, we're going to get the best use of those resources for those service areas, whether that be in relation to drug and alcohol services or mental health services. We are absolutely, it's incumbent on us to make sure that for each service we're using the reserve in the best possible way to deliver the best possible service through the eyes of COVID. So that was hopefully to answer the first of Ronnie's questions. In relation to the 3-year financial plan, the latest correspondence from the Director Finance NHST side was around the need for a further meeting to understand where we had got to in relation to financial balance and any further actions NHST side might require us to take. That meeting is currently being scheduled.
Thank you. Mr. Erskine, did you want to make any further points, or were you happy with those responses?
No, that's great. I mean, the accounts themselves look ideal. Thanks.
Okay, thank you. Can I ask if any other members have either questions or comments on the draft annual accounts, and if they could indicate if they do? Okay, I'll take that as a no. With that in mind, I will suggest, therefore, that we note the recommendations in the report, and it's recommended that the Audit and Performance Committee authorises the Chief Financial Officer to sign the unaudited annual accounts on behalf of the IGB. Can I ask if any members do not support that recommendation, and to indicate if that's the case? Okay, I shall therefore take that as members' support. Mr. Erskine, were you going to say something different?
I was desperately trying to scroll to the front page of the paper, which I've failed to do in the time that you were speaking there. So I know that Jane had mentioned the annual governance statement, you know, not conditional, if you like, on that being approved over the next few days. So I couldn't quite find what the specific recommendation was, whether we need to make it conditional or whether it's as is. You may have it in front of you.
It simply says the unaudited annual accounts will be submitted to the Controller of Audit by the 30th of June 2020, subject to the approval by this committee and authorisation by the Chief Financial Officer. It is recommended that the Audit and Performance Committee authorises the Chief Financial Officer to sign the unaudited annual accounts on behalf of the IGB. I think that the decision that we take now would not overwrite the decision that we just took a few moments ago in relation to the annual governance statement, and happy for that to be minuted to be made explicit that this is the draft annual accounts, except the annual governance statement, and obviously the fact that they were coming forward as two separate papers emphasises that fact.
Thank you.
Okay, well, given that, I'll take it that the committee is in agreement to approve the draft annual accounts. Okay, thank you very much. Finally, we have for information the Audit and Performance Committee record of attendance for 2019-20. I'm going to assume that there are no questions on that. And then finally, can I ask members to indicate whether they want to have a private discussion with the auditors or not? Preferably an indication one way or the other.
No, not for me.
Okay. Councillor Duff? Okay, that's fine. And I think those are all, we are the only 3 members who are still on. I think Mrs. Kilpatrick has left the meeting. So on that basis, I'm happy to conclude the meeting. Can I thank everyone for their attendance today, and in particular to thank officers for pulling together these reports, particularly given the current situation and the strain on resources at the moment. And thank you to everyone else who's in attendance at the meeting today. The next meeting is scheduled for Monday, the 14th of September, and I look forward to seeing you all then. Thank you very much.
Thank you, Chair.